Today, we are talking about the 7 top most painful surgeries one can have. Right this way through the OR doors, please. Okay, so if you've ever been told you needed to have surgery, I am sure that you wondered just how much pain you were going to be in after it was all over, after you were post-op. Just how debilitated were you going to be if you had to have one of these following 7 procedures? All right, so according to data from the National Center for Health Statistics, 48 million inpatient surgical procedures were performed in the United States. And on the following list, I've actually had one of them, so I can speak with personal experience. Now, once the pandemic hit, this number dropped significantly because there was a mandate that all non-emergent procedures be canceled. This also included all elective procedures, which included cosmetic surgery. So on this list, we're going from number 7 to number 1. And speaking of cosmetic surgery, liposuction is number 7. This process of fat removal, although less invasive than most surgeries, involves insertion of a large bore cannula into the area through a small incision. Sometimes several incisions actually, where fat will be removed, which ultimately still involves irritation to the nerves and blood vessels. This triggers a direct pain response because injury to small vessels results in oozing of blood and triggers an inflammatory response and pain. Patients will typically be under general anesthesia, meaning they're completely knocked out, but depending on how extensive the surgery and the liposuction is and the specific areas being worked on, this is rough.
Cool.
The areas that got the top vote for most painful liposuction procedures were the hips and underarms. Personally, I'd have to think that the chin would be there too. I don't know. It's such a delicate area there. So anybody watching, if you've had it, or any plastic surgeons, just drop a comment and please weigh in. All right, number 6, dental implants. This procedure is needed when someone needs a part or an entire tooth replaced. So in order to have the tooth function and stay in place, the doctor needs to drill deep into the gum. The oral surgeon will drill deep into the gum, and a metal rod is then screwed into the deep tissue and jawbone. Also, if there isn't enough dense bone in the area to support the screw, then bone may need to be grafted first. This entire procedure from beginning to end occurs in multiple stages. So until the new tooth is in, there is a lot of healing you have to go through, and it's in between and after each visit. So I actually have some personal experience with this. I've had 2. One was due to an almond, and the other was due to a Cheez-It. Yep. In my defense, it wasn't a regular Cheez-It, it was the Ridges, if anybody's ever had them. These are like little delicious cheese-flavored squares of metal. I love them, but they were responsible for, $3K worth of dental work. Yeah. Next is myomectomy, and this is a procedure which involves fibroids being removed from the uterus. So fibroids are non-cancerous growths that can develop in the uterus, which cause really heavy bleeding and extremely uncomfortable menstrual cycles. The uterus is accessed through an incision made into the abdomen, and then this tool is used to cut up the growths into smaller pieces and remove them. Now, this procedure can also be done through a vaginal entry, and this is called a hysteroscopic myomectomy, or can also be done laparoscopically, which uses a robotic arm like this one. So recovery is not fun because normally there's more than one fibroid that's been removed. So once anesthesia wears off, pain meds are your best friend. And a side note, shout out to all of my awesome anesthesiologists out there. Anesthesia, in case you all didn't know, wasn't discovered until 1846, and if I'm not mistaken, it was discovered completely by accident, I'm pretty sure. The first successful public demonstration of the use of diethyl ether as a general anesthetic occurred at Massachusetts General Hospital in what is known as the Ether Dome. Boston dentist William T.G. Morton used sulfuric ether to anesthetize a man while Dr. John Collins Warren removed a vascular tumor from a man's neck. Interestingly, despite health professionals using it every day for more than 150 years, the molecular mechanism by which general anesthetics produce their effects is unclear. Yeah. So yeah, we still aren't 100% sure quite how it works. Number 4, total hip replacement. Open hip replacement can take up to 3 hours from start to finish, and the hip is kind of a large bone. All of one's weight rests on this area where the femur head joins the hip, or what's called the acetabulum. And the incision to gain access to this area is a pretty large one as well, about 10 to 12 inches. Then the skin and muscle are cut away, and then the bone is removed, so all of the damaged bone can be replaced by synthetic material. The other issue is the doctor may need to smooth out the socket prior to insertion of the prosthetic joint. So a tool equivalent to basically an electric sander is used for this. Basically, for this surgery, the OR turns into your dad's backyard shed. Literally. Recovery here is about 6 to 12 months as the body rebuilds tissue and muscle around the healing hip. The body is just incredible, right? It is. Just agree. Just agree. Thank you. Number 3, hemorrhoidectomy. Does this one really need an introduction?
Come on.
I'm going to say no. Infected and inflamed tissue is removed from the rectal canal. This tissue is basically comprised of varicose veins, but in the booty.
Okay.
And sometimes, if the bleeding is profuse after all of this tissue is removed, they'll staple the area shut. Yeah. Not much more to say about this one, but personally, I know a few close friends and patients who have had this and have said, quote unquote, "This is the most pain I have ever been in, and I would absolutely never do it again." The other catch-22 here is that you're typically prescribed pretty strong pain medication afterwards, like Percocet or Vicodin, and one of the side effects of opiates is constipation. So you're in so much pain that you'll take this pain medication regularly, but it can actually make the first bowel movement post-surgery excruciating, to the point where I know a few people who actually didn't wind up moving their bowels and had to be taken back into the operating room to have a surgical disimpaction.
Come on!
So yeah, this is basically being brought into the OR and having your surgeon surrounded by an entire surgical team just going up in there and manually pulling it all out. Yeah. If there's anything on this earth that gives a glimpse of what hell may be like, I'd have to think that this may be one of them. I'd have to think. Anyone disagrees with me, step right on up.
No, wait,
but I kind of think that's going to be pretty silent. I think we're going to hear crickets on that one. Anyway, number 2, skin grafts. Here, a piece of skin is cut from one part of the body and transplanted on another. This can be needed due to burns or other surgeries where maybe there's been a large amount of skin that's been damaged. Now, remember, skin is the largest organ on our bodies, and think about how painful it is when you get a paper cut or a small burn on your finger. It hurts. And that's because of the millions of nerve endings in the epidermal layer. So afterwards, the care of this area is also quite uncomfortable because these areas need to be kept immaculately clean, which means frequent dressings. And often these areas will weep, or there might be some dried blood or pus that it causes the bandage to adhere to the healing graft. And during dressing removal, I mean, imagine scaling up a Band-Aid being ripped off by 1,000. That's the pain that we're talking about here. And after all of this, there's actually a chance that the graft might be rejected by the body. The pain receptors are constantly firing during healing and regeneration, and yes, this is a very unfortunate reality after going through all of that. And finally, we come to number one, numero uno on this list, the most painful surgical procedure, which is a bone marrow biopsy, or extracting tissue from the inside of a bone. This is typically done to diagnose blood disorders such as leukemia, or to show whether your bone marrow is healthy and making normal amounts of cells. We'll also use this procedure to diagnose and monitor blood and marrow diseases, including some cancers, as well as fevers of unknown origin. The only way to do this is to take what's called a trocar and pierce through the skin, muscle, and outer surface of the bone. The reason this is so painful, even though the area is numbed with local anesthetic, and some will have even regional blocks, you can't numb the inside of a bone. You can't numb a bone. And this area is highly concentrated with nerves. So if you think about it, when you break a bone, the pain comes from the disruption and damage to the nerves that run along the outer and inner part of the bone here. A massive flood of pain signals are transmitted here because of the combination of the pain from the needle penetrating deep down into the tissue and the destruction of a part of the bone as that needle is corkscrewed down into the hollow portion of where that marrow resides. And the most common bone that's used for this is the pelvic bone, or more specifically, the posterior iliac crest. And there you have it, the 7 most painful surgeries patients can go through. Drop a comment if you've had any of these procedures, because let's face it, those stories are the best, and I'd totally love to hear your experiences. Also, watch for our blog under the same name coming this spring, where I'm going to talk about a lot of the topics we talk about in the videos every week, but I'm going to get a little deeper into them. And then finally, what would Lucid Med be without bloopers? Still an awesome video, but bloopers are my gift to you. They make the world go round. This way. You suck at throwing.